I've created this website to share some of the things that I've learned about pain from my patients, from research, and from trial and error. Techniques that have helped my patients over the years. I hope that they can help you. When you have chronic pain, it's hard to follow any program. It's hard to focus, so take it slowly. Explore different parts of the program. Find what works for you. Become a pain expert. If you're able to, share your knowledge. You can write to me by clicking on the contact that you will find in the top menu. To manage chronic pain, I think trust and communication is vital. We need to ask ourselves, do we trust our healthcare providers? Do they trust us as partners in our own care? Do we trust ourselves to know how to improve our pain? I'm hoping the program will increase your confidence in managing your pain. Please don't follow this program without first speaking to your healthcare provider. No program is foolproof, and I've pretty much created this program on my own. So if you have questions or you're struggling, contact me on the contact form. I can't answer emails individually, but I will share your questions and input anonymously on my blog. Use your voice to make a difference. It's hard to know where to start. If you have acute pain or mild pain in a specific area, go to the main menu and click Types of Pain. If you can't find what you're looking for, contact me. You never know, you might be interested in the next bit, so stay tuned. Chronic pain, moderate to severe chronic pain, widespread pain, even irritable bowel syndrome. These are conditions that are very difficult to treat. Any pain lasting longer than 3 months is chronic. It may not be there every day. Migraines and headaches, they're a form of chronic pain. Pain is not all in your head, but we need to start with the brain. If it's not all in the head, why start with the brain? Well, I'm going to ask you to bear with me. You may have seen on TV how brain surgeons can operate on patients who are awake. That's because most of the brain doesn't feel pain. Not even skin, muscles, tendons, and nerves feel pain. So why and where do we feel pain? I want to demonstrate the process of pain the easiest way I know how. I'm going to start with stress. If you have chronic pain, you have stress. Physical stress affects the area of the brain called the limbic system. The limbic system is the part highlighted by a yellow arrow. Let's use science. This is a scan. On the left is a normal brain. It's showing only mild stress, likely from the person lying in the scanner. The scan on the right is lit up in yellow and red. It shows a brain in severe stress. The examiner has triggered a flashback in a person who has PTSD. That's about the worst stress you can get. The brain on the left, it's the same brain, but before the stress of a flashback. This is a different view of the stressed brain. When you're looking at these colors, remember that the darker the color, the less sugar is being used. So the area that's noted with a red arrow, that's pretty dark blue. That shows the brain is not very active in that area. If you look at the yellow arrow, that area is very active. It's using a lot of sugar. That area that's pointed by the yellow arrow, that area is the limbic system. It's a pretty old term, but I'm going to keep using it. The limbic system is the most primitive part of your brain, and the areas of the brain that feel pain are in the limbic system. Let's simplify matters and call the area that feels the pain the thalamus. The limbic system is actually the alarm system of the brain. It's pretty stupid. Yep, yours and mine. I said it. Pretty stupid. The limbic system can't tell the difference between an attack, an injury involving blood loss, or anxiety. It can't even tell the difference between good and bad stress. It just lights up with stress and goes into flight, fight, fright mode. And the thalamus? That lights up like a nuclear bulb. So now we've learned the limbic system is responsible for pain. I'd like to demonstrate it in yet another way. Imagine the brain is this fist that you see below. The finger points to the thinking part of your brain. That's on the left. That's the part wrapped around the limbic system. It's responsible for planning, organizing, executive functions. That's your smart brain. If you look at the picture on the right, you can see the thumb neatly tucked in. The thumb is going to represent the limbic system with the pain area, the thalamus. Here's a brain in stress. Ah! The thumb is way out there, right in the action zone. It's run away from the control of the smart part of the brain. The more active the limbic system, the less active the thinking part of the brain. So now you've figured it out. The limbic system, the alarm pain center, that's where the yellow arrow is. And the red arrow? That's the thinking, planning, organizing part of your brain. That's shut down for business. Does that explain the brain fog, the memory problems? So let's wrap it all up. To improve pain, we have to calm the limbic system. Without calming the limbic system, the alarm system won't shut down. The system can calm down when the pain goes away, but if the pain doesn't go away, or if you have lots of stress, the alarm system stays on. Even the smallest amount of pain that is usually ignored by the smart brain, that small amount of pain can be felt as moderate to severe pain. I hope I've explained why pain is not all in your brain. If your alarm system is on high alert, then even the smallest messages sent to your brain, messages meant to have you change a posture or move a little to prevent pain, all these tiny messages can be read as pain. If your pain is severe, you may require medications to help you quieten the alarm system. Some people have severe anxiety and depression, even PTSD. This keeps the darn pain center overactive. Trust me, pain cannot be adequately managed without also managing anxiety and depression. Complete the pain forms. There's a simple one in step 1 and a link to more complex pain forms that you can share with your doctor. Good luck. Painimprovement.com has been created to help you find ways to relieve pain. Not everything works for everyone. Without using all available tools, chronic pain is very difficult to treat. Ask for help. My thanks to NERD, which is a non-profit physician program from wonderful BC, Canada. Thanks also to Self Management BC and Pain BC. Please note I've received no funding from any pharmaceutical profit organization. I don't endorse all the videos on the web. Please don't follow the program without the advice from your healthcare provider. Contact me, use your voice, and become part of the solution.